patients literally everywhere. In the corridors, even on the stairs, in newly opened department like a mother and child, an obs and gynae department, etc. Trauma patients everywhere. The same applies for Al-Ahli and also in Khan Yunis Nasser Medical Complex. All of them operate on 250 or 300% capacity. We're also deeply concerned about currently, now on Al-Ahli and patient-friendly hospital in the north, because they lie close to the evacuation zone and the risk of becoming non-functional if not protected. And we have gone through this many times already in this horrific crisis. So what is the impact of an intensified Gaza City offensive, a military incursion, and further mass displacement? Every pillar of life in Gaza is being torn apart. Food, water, healthcare, sanitation, dignity. Nothing is spared. So as WHO, we warned that the plan to intensify military operations, military incursion, however you call it, in Gaza City will have a horrific humanitarian impact on people and the near collapse health system. We will witness many more civilians killed and injured in an environment of malnutrition, and I would say general exhaustion from all. Also, together with all partners, the UN, WHO, we've poured immense effort into reviving what remains of Gaza's shattered health system. Yet every surge in violence pushes it closer to collapse, crossing red lines that must never be crossed. This must end. WHO will stay in Gaza City and deliver where people are. The UN will not be part of any forced displacement of people to the south. We want to remind the parties to the conflict of their obligation under international law to protect civilians, including humanitarian workers, and those who cannot or choose not to move, and to safeguard humanitarian facilities and other civilian infrastructure. My last part is on European Gaza Hospital. This is located East Khan Yunis, just east of the Saladin Road. So on 16 August, WHO and partners visited the European Gaza Hospital, while numerous previous attempts to access the facilities have been denied. Maybe you remember there was already, I think a couple of months ago, WHO organized a medevac from European Gaza Hospital. That hospital was attacked. Then we could carry out a medevac. We evacuated the patients, the staff, etc. Since then, the hospital has been non-functional. But we assessed that the roads are severely damaged and possibly impossible for trucks and ambulances. Areas outside the hospital premises are heavily damaged, particularly outside of the emergency department and the outpatients department. The infrastructure is damaged, especially in the prefabricated extension and some ancillary buildings. And the initial findings suggest it may take up to 3 months to resume if we talk about secondary care services, not primary care services. Alexandra, I want to stop here. Over to you.
Thank you so much, Rick. Sorry, we are trying to at the same time do 20 things. Just wanted to inform you that the statement of the Secretary General on this terrible announcement of this morning is now out, is in your mail boxes. And the Secretary General is saying, just when it seems there are no words left to describe the living hell in Gaza, a new one has been added: famine. This is not a mystery, it is a man-made disaster, a moral indictment, and a failure of humanity itself. Famine is not only about food, it is the deliberate the deliberate collapse of the systems needed for human survival. People are starving, says the Secretary General. Children are dying, and those with the duty to act are failing. As the occupying power, Israel has unequivocal obligations under international law, including the duty of ensuring food and medical supplies of the population. We cannot allow this situation to continue with impunity, says the Secretary General. And he concludes by saying no more excuses. The time for action is not tomorrow, it is now. We need an immediate ceasefire, the immediate release of all hostages, and full unfettered humanitarian access. You have it in your email boxes. It has been published on the social media accounts. We'll finish this part of the briefing with Jeremy, who also has a comment on behalf of the OHCHR, and then I will open the floor to questions. Thank you, Jeremy.
Yes, thank you. You should have all received the statement issued by the UN High Commissioner for Human Rights, Volker Turk. It was issued a short time ago. In it, he says, "The famine declared today in Gaza Governorate by the IPC is the direct result of actions taken by the Israeli government. It has unlawfully restricted the entry and distribution of humanitarian assistance and other goods necessary for the survival of the civilian population in the Gaza Strip. We have already seen deaths from starvation and malnutrition across the Gaza Strip. The Israeli military has destroyed critical civilian infrastructure, almost all agricultural land, banned fishing, and forcibly displaced the population, all drivers of this famine. It is a war crime to use starvation as a method of warfare, and the resulting deaths may also amount to the war crime of willful killing. The Israeli authorities must take immediate steps to end the famine in the Gaza Governorate and prevent further loss of life across the Gaza Strip. They must ensure immediate entry of humanitarian assistance in sufficient amounts and full access to UN and other humanitarian organisations."
Thank you very much, Jeremy. And more reactions on the IPC report is coming now from our colleague in UNRWA, and I've been asked to read this to you. This is the statement by Philippe Lazzarini, the Commissioner General of UNRWA, who has just published a post where he says, "Months of warnings have fallen on the deaf ears. Famine is now confirmed in Gaza City. This is starvation by design and man-made by the government of Israel. It is the direct result of banning food and other basic supplies for months, including from UNRWA. The spread of famine can still be controlled by a ceasefire and allowing humanitarian organizations to do their work and reach starving people with aid." And he concludes by saying, "Time for political will." And you also have the possibility of reading this post on CG Lazzarini's X account, sorry. So we now go to the questions. I see already quite a few hands online, but let me start with the room. Robin, AFP.
Following this declaration, we might well now see countries rushing to do airdrops to show that they are doing something about the situation. Is that enough? To what extent is that useful or even dangerous compared to delivering aid by land?
Thank you very much. I don't know who would like to take this on. Maybe Jean-Martin. I start with Jean-Martin Bauer. Jean-Martin, Robin is our AFP correspondent.
I'd really like to focus on the situation in Gaza and how serious it is according to the findings that we have. Airdrops are a solution that's not going to resolve this problem. What we have is a famine taking place. We need to make sure that we address a famine in the way it needs to be addressed, and that means looking at the malnutrition rates, looking at supporting the systems on the ground. When you move from a food crisis to an outright famine, there's a step change that occurs. We need to think about a response that meaningfully addresses the needs of the most vulnerable, and that's the needs of little children. I'd like to perhaps pass it on to my colleagues in Gaza.
Rick, would you like to also answer this question, please?
Yeah, I think we've gone through this before, and we shouldn't forget we are almost 2 years in this horrific crisis, and I think having been also part of that as a WHO rep, we've seen this constant, it's almost like a squeezing, a strangling of the Gaza and its population, and then a little bit of a release, and then again a strangling, etc., etc. We have seen these cycles. We've also seen airdrops in the past. I think it's all well intended, so I don't want to, belittle it, etc. And in extreme emergencies, and if people cannot be reached in any other way, they potentially can be useful, but not in that sense in Gaza. There's a system in place. We have proven as the UN and its partners, even before, during this whole crisis, and specifically when there was this temporary ceasefire, that when actually humanitarian assistance is even a little bit facilitated, it has never been properly facilitated all along, that people are reached. They are reached in a way more cost-effective way than these airdrops. And it would be good for somebody to make an analysis about the cost of the airdrops during this crisis, including now. And then, for example, the humanitarian community here, we are struggling to get a sustained flow of fuel, just to mention one thing. We probably could have a sustained flow of fuel for the coming year to come, etc., when you offset it against the cost against these airdrops. So these airdrops are definitely in the Gaza situation extremely cost ineffective. They're occasionally dangerous. People have been killed. We also have seen, at least I've seen it in my own eyes with the former airdrops, I didn't see it this time, that sometimes medical supplies are included, which can be very dangerous because they are just dropping everywhere, and they are not like collected or somewhere and then they go to a hospital, etc. I remember in this first range of airdrops, we even saw some sachets with morphine we identified. So in short, well intended, not needed in Gaza. There's a system there, there's a system in place, and I really would back, invest those funds in a proper humanitarian approach, etc. UN and partners are very much ready for that. Over to you.
Absolutely. As we heard this morning from Tom Fletcher, we are ready to go, and we should let be in at this point in time and very strongly. I'll go now to Emma Farge, our correspondent of Reuters.
Good morning. Question for WFP and for WHO. I'm wondering whether the first steps in the Gaza City military operation are already making aid flows more difficult, either into Gaza or within Gaza. Are there extra impediments because of this campaign? And for Dr. Pieperkorn, please, I'm wondering how famine is affecting other patients, trauma patients in hospitals who will need a certain amount of calories to recover. Can you tell me how other patients are being affected by starvation? Thank you.
Absolutely. Okay, Jean-Martin, you want to start with the first question?
Okay. What we've seen in the past few weeks in Gaza City has been an exponential increase in child malnutrition and acute malnutrition. This is a very worrying situation, and it's one of the reasons why we're now talking about a famine in Gaza City. The data is there and shows how urgent it is to devote specific attention to the children in Gaza City. And the worry is that along this path, the numbers could get worse. I told you that the acute malnutrition in Gaza City has tripled since May, between May and July. And because it is a geometric increase, we could have a doubling very quickly. This needs to end right now because of its very real impacts on many children in that part of the Gaza Strip.
Thank you. Enrique, maybe on the second question?
Yeah, let me add, and also a little bit on the first one. So what we of course see happening in the north of Gaza, and this increased hostilities which are already going on. And then I think I would say almost the mass casualties incidents surrounding any food distribution. We see this huge increase in trauma and trauma patients, and what I reported on, and just to give some figures, situations escalate sharply in July with daily fatalities of an averaging 119, so nearly double the average recorded in May. So as if we were back in the first 6 to 8 months of this conflict. Injuries also surged dramatically with nearly 14,000 in July compared to 6,000 in May, and a reflection of that you see in we see actually in this we see that in all the hospitals, this completely that all those hospitals have become massive trauma wards. I just want to say something about malnutrition, because we get this question as well. So how do we then support malnutrition? And then we'll address the question how it impacts. So as we all know, that malnutrition can be a direct cause of death or a contributing factor, and that often weakens the immune system, making the body more vulnerable to infections and other diseases. And as such, malnutrition may be the primary cause of death or be a cofactor, and increases the risk of mortality and conditions. So we are supporting actually the hospitals, the Ministry of Health, in verifying malnutrition-related deaths and using agreed technical guidelines. Special committees are formed in each hospital. This committee review all non-trauma deaths from the previous 24 hours and check if malnutrition may have been a factor. And to do this, they assess such as the MITS, upper arm circumference, weight for height, etc., body mass index, etc., and any recent signs of severe weight loss and other diseases, underlying conditions. And the criteria are adapted for each age group. So, and the death report from WHO or by the Nutrition Stabilization Center also reviewed together with those committees on the same criteria. Now, the question, so why do I want to be clear on this one? Of course, the generalized malnutrition, which you see everywhere, impacts everything. So we see, for example, and having witnessed so many trauma patients and talking to the medical specialists and surgeons, etc., recovery takes way more time for every patient, and people don't recover. Recovery from wound infections, etc., takes way more time. All of those things are related to the, I would say, to the almost generalized malnourished state of so many people in Gaza. And I think and you see that in the IPC report, rightly so, there's always a focus on under five children, because they are the vulnerable group, small children. But the IPC report, and we've pointed this out as well many times, also points out they are deeply concerned about, let's say, the older children, adolescents, and the elderly. Not just trauma-related, let's say, injuries that people recover, the recovery time takes way longer or it doesn't happen, but also elderly and other people suffering from non-communicable diseases, etc. So if you are in we all know, a better physical state, and at least well-nourished, etc., the whole, even your medication, etc., makes a much better impact. So yeah, it's a huge impact on every health-related condition. Over to you.
Thank you very much, Rick, and thanks to Jean-Martin. I'll go now to Gabriela Sotomayor, our correspondent of Proceso.
Thank you, Alessandra. Two questions, if may I. So this is a famine that has been predicted for a long time. Why are you announcing it now? What's changed? And the second question regarding accountability. I'd like to ask you, it's obvious that Mr. Netanyahu is responsible, but so are the complicit governments that have supported him. Is that correct? You more than anyone are witnessed of what is happening. So can you indict Mr. Netanyahu in an international court? Do you recommend a court like others established in the past, like International Criminal Court of Rwanda, for example? Thank you so much.
Thank you, Gabriela. So I'll ask maybe Jean-Martin to answer your first question. I think he did actually explain, but maybe you want to reiterate this for our journalists. And Jeremy will take your second question. Jean-Martin.
Absolutely. What I'd like to emphasize here is that there have been many warnings of a risk of famine in Gaza from the IPC and the Famine Review Committee. Those warnings began in late 2023, and the last time we were here together to discuss the IPC process for Gaza, it was on July 29th when there was an alert issued. So there have been many, many warnings along the way. I need to emphasize that the IPC is a 21 agency partnership. It includes intergovernmental organizations, UN agencies, NGOs. It's a very robust process that has been ringing the alarm. So the question is, why now? Well, as the last time we spoke in July 29th was the moment when in Gaza City we saw indicators breach famine thresholds. That has been the case for food consumption. It's been the case for malnutrition. And what's happened since is that the experts have worked on the data for the entire Gaza Strip. They've looked at updated information, also in the case of mortality, and that allowed a famine determination to be made and confirmed by the Famine Review Committee. So this is a process that's very meticulous, it's very precise, and that reached its conclusion just a few days ago. And this is why we're coming out today with this confirmation of a famine in Gaza City.
Thank you very much, Jeremy.
Yes, thanks, Gabriela. There are, I guess, two parts to this question. First and foremost, as the High Commissioner said, it is Israel's responsibility to open the borders and to ensure aid flows in at massive levels immediately. As he says, it's a war crime to use starvation as a method of warfare, and the resulting deaths may amount to the war crime of willful killing. I'd also like to point out on, with respect to third parties, because I think you raise an interesting point, and it goes to what the other journalists raised earlier. And when we talk about international humanitarian law, which is, and specifically the Geneva Conventions, which are the cornerstone of international humanitarian law. And it states, Article 1 of the Geneva Convention states that all contracting parties must undertake to respect and ensure respect for the convention in all circumstances. All states have an obligation to prevent a violation that may be committed. The greater the degree of influence, the more measures a state is obligated to take. It's quite clear.
It is quite clear, and also refer to the statement of the Secretary General, Gabriela. Oh, I see you have a follow-up. Then I'll go to ARD-NFA.
Thank you very much. So the cruelty of this punishment, I am not a doctor, but how long a person has to suffer from hunger to die? I mean, how many days? The cruelty is it's really, I don't know how to describe in English, but it's beyond measure. can you say something about this process of a person to die without food and water?
Yeah, maybe I will ask Rick to take this one.
Yeah, I find it a difficult question, and also, you know, maybe I don't want to go into this discussion of cruelty and everything related to that. It should just simply not happen. And I think, as has been mentioned, we're talking about a man-made malnutrition crisis. And I think so men can also fix this. I also want to stress it's very difficult because, I think I just referred to that earlier, that malnutrition can be a direct cause of death or contributing factor. And it often directly, of course, weakens the immune system and it makes the body more vulnerable to infections and other diseases. We see this incredible poor water sanitation conditions all over Gaza, and already from the start of the crisis, and vastly deteriorating, which are all cofactors. So it's sometimes difficult to also say, is this malnutrition the primary cause, or is it definitely a cofactor? So we, in short term, in days or weeks, we see weight loss and muscle wasting, fatigue, weakened immunity, etc. What I said, and then we get when it takes a little longer, you just talk about micronutrient deficiencies, which cause anemia, poor wound healing, which I already referred to, which is every time you go to these trauma wards, etc. The doctors there and nurses, etc. tell me that. I mean, like how incredibly long term, and then with all the risks of this multiple and this multi-drug resistance, of course, which is increasing as well, and higher risk of infection of anything. And on the long term, and that is, I think, we even don't think about enough that when you talk about long-term stunting, and for children, you can talk about organ damage and delayed development, and of course in severe cases also death. For young children, can happen very quickly, as we know, in a few days without and weeks without adequate feeding, because they have a high nutrient needs, etc. Adults, especially elderly, etc., the visible signs can take longer, but I think it's not for nothing that also the IPC report points out, hey, this is so generalized, and yeah, we focus on children under 5 as a special vulnerable groups. But please also take care of the older children and the elderly. And I see, by the way, also around me and even among my own teams and staff, etc. In general, there's much more of almost a lethargy. People not only are exhausted, etc., but hardly anyone gets proper, diverse food. And that is even for the ones, humanitarian workers we work with. So let me leave it here. Over to you.
Thank you very much, Rick. We feel despair. Let me go to ARD, Tobias Haller.
Yes, thank you. I am asking the question. I'm Mara Probst. I'm also from the ARD German TV and Radio. I'm asking the question for Mr. Haller.
Please.
Thank you. I have a question also for the WFP or the WHO, which we've heard it before that there are certain factors that led to the declaration, and we heard that it was mortality was one of the factors. Could you please elaborate again, maybe, or emphasize on which factors you kind of based this declaration and what made it phase 5? What were the essential factors? And also, what will be the direct consequences of this declaration? What will be the consequences for Israel? What will have to be done? And also, whether this phase 5 is set for all of Gaza, so like 100% of the population, or how much percent of the population is affected? Thank you.
Thank you. Again, I think Jean-Martin had spoken about that, but I'll give him the floor again, maybe to just underline these few points. And Rick, if you want to add something afterwards.
Okay, well, look, what this new IPC analysis tells us is that there is a famine in Gaza City, but IPC5 conditions also cover other areas. And there's a distinction between famine and IPC5. Let me explain that quickly. The IPC is a 5-point scale. Phase 1 is a normal, 2 is stress, 3 is emergency. 3 is crisis, 4 is emergency, and 5 is a catastrophe. When you've got enough people in phase 5 and there's a review by the FRC, then that can be confirmed as a famine. So phase 5 and famine are two things that are related but not exactly the same. So what we say in this release that came out just recently is that there is a famine that's confirmed in Gaza City, but the phase 5 conditions are now affecting 500,000 people and up to 630,000 in between now and the end of September. Now, in terms of mortality, what the report says is that, and this was looked at by the FRC, who include experts in the areas of food security, nutrition, and the study of mortality. They tell us that mortality is usually underreported in Gaza, especially for non-trauma deaths. And that's because of the breakdown of the information systems in place. So the health systems is now experiencing a surge in illness and things like multi-drug resistant infections. That makes treatable injuries increasingly fatal. Newborns face elevated mortality risks as well because there's been a collapse in neonatal intensive care. And there's a convergence of widespread malnutrition, illness, and collapsing health systems, deteriorating wash conditions. Water and sanitation is very problematic, and increase in child diseases, in addition to a very worrying increase in acute malnutrition. All that led to the consideration that governor at Gaza City reached a famine level mortality.
Rick, you want to add something?
Yeah, maybe a little bit. I think Jean-Martin, raised all, and I think it's, and you can find this, by the way, in the IPC report. So, I mean, for classifying famine, it means that that's the most extreme category, and it's triggered when 3 critical thresholds are met. So extreme food deprivation, acute malnutrition, and starvation-related deaths, and they have been breached. And the latest analysis now affirms, on the basis of reasonable evidence, that these criteria have been met. I mean, like for the Gaza governorate, and maybe to add there, because you asked a bit. So you talked about 500,000 people facing catastrophic conditions characterized by starvation, destitution, and death. But another over 1 million people, 54% of the entire population, are facing emergency IPC phase 4. And close to 400,000 people, 20%, are in crisis, what is called IPC 3. And maybe to say one more thing, if nothing would be done now, and the report also is clear on that, then it's projected, not just if you look at acute malnutrition of children, which is that really exponentially increasing, but it's also over the longer term, if very little happens, that it's projected that through June 26, part of the report, at least 132,000 children under the age of 5 are at risk of death from acute malnutrition, according to this IPC analysis. And also this number has doubled compared to the IPC estimates reported in May 25. Over to you.
Thank you, Rick. And this figure are really appalling. And so let me go to the last questions from Isabel Sacco, the Spanish news agency.
Yes, good morning. Thank you very much. I there is already a reaction by Israel to the report. And I would like to read to the representative of IPC what Israel says, denying all the main result of the report about famine. So Israel says, the IPC twisted its own rules and ignored its own criteria just to produce false accusations against Israel. The IPC changed its own global standard, cutting to 30% threshold to 15 for this report only, and totally ignoring its second criteria of death rate, solely to serve Hamas fake campaign. Thank you for your response.
Maybe, Jean-Martin, I think you had spoken about some of the criteria. Maybe you want to answer our journalist.
Sure. So what I'd like to say is that, again, the IPC is the gold standard for food security analysis worldwide. The indicators we used in Gaza that the IPC used, and I'm not the IPC representative, I'm the WFP Director of Food Security Analysis, but the indicators that the IPC used for this analysis have been used in other countries. I told you earlier on that there have been famine determinations in the past in Somalia, South Sudan, Sudan. We used the nutrition measure used in Gaza in the past as well. I think what I've heard as an objection is that we used the mid-upper arm circumference as a measure for malnutrition instead of weight for height. That's something that is allowed for in the IPC protocol and has been allowed for by the IPC manual since 2019. And this measure that we used in Gaza for the determination was also used in past famine declarations in South Sudan and in Sudan. So the protocols have been applied in the case of Gaza. And I remind you that the IPC also has a strong governance mechanism that includes a famine review committee with the foremost experts in food security and nutrition and mortality that looked at the data. And we can take this finding as seriously because this is the gold standard in food security analysis worldwide.
Thank you very much, Jean-Martin. I see Rick wants to add something.
Well, it's difficult to add something. I think Jean-Martin has been very clear, not just the gold standard, but it's also a very well established global system. So I think it should be taken seriously, very, very seriously. And it's factual. I also want to remind that everyone who's working here on the ground, and anyone, for us, WHO, I heard it from my UNICEF colleagues and many other NGOs and colleagues, etc. We see this happening on the ground, and we have been warning constantly on this. So is it a surprise for us? No, it's not a surprise. And this is so, I mean, like overwhelming when you see this, not just in the hospitals, etc., within the communities, etc. I also want to make the point that we have had previous debates on, on mortality rates and the number of people killed and injured, etc. And like we have raised before, I think every one of us tries to be as factual and analytical as possible. And I'm afraid we're talking about underestimation in many of these topics. So maybe that's all what I want to add to this.
Yeah, indeed. And Jeremy, you want to also add?
Yeah, I'd just like to add one thing, well, a couple of things actually with respect to this, and just echoing what my colleague's saying there. The first is we are witnessing people starving to death already, beyond what this report is saying. That is beyond doubt. The second thing is this: we have been talking about flagging warning about this nightmare scenario, which is going to present itself through the declaration of famine. Now, so now we're at the stage where this nightmare scenario is reality. It's horrible, cruel, unforgivable, reality, what's happening on the ground, as stated in the declaration. And the other thing is, I just reflect on the fact we've talked about our office on the stain of a stain on humanity when it comes to events that have been unfolding in Gaza. Maybe today we need to reflect on the fact that inhumanity, our collective inhumanity.
Maybe,
Yeah, and
Alexandra,
yeah,
can I maybe add,
yeah, sure, Rick. Go
add
ahead.
one thing? You know, also the IPC over the years, etc. What I understand, it is definitely not the IPC experts. I'm not speaking, but it's not just the UN. It's 21 organizations, including respected NGOs, with long experience in dealing with hunger, malnutrition, and its effects. Yeah, and this kind of questioning and arguing about the reports, it makes me incredibly sad. I mean, like, we got to do something about that. You know, please, can we please do something about this? Can we please, I mean, like, make sure that this is reversed and this never happens again? Can we please work on that? I think these petty discussions about arguments, about data, etc. There's a massive disaster going on. We can all witness it. We can all see it. Can we please help solve this? Thank you.
Absolutely. This is indeed a humanitarian catastrophe of epic proportion. And as we've been saying the whole morning, famine must be stopped at all costs. And this is a race against time. To end this terrible situation with an immediate ceasefire and humanitarian response at a very large scale, unimpeded, that will save a life. Gabriela, sorry, let me go to Christian, because she's not asked any question. Then if we have time, I'll go back to you. Christian Rick is our correspondent of the German news agency.
Thank you, Alexandra. And I'm sorry, Rick, I totally agree with you, but because this information is out there, we do have to follow it and verify what the facts are. We report all the time that there's this 30% threshold on, let me just read it properly, on children that suffer from malnutrition, and the Israelis are saying in this particular report, it's only 15%. I haven't found that immediately, but to refute that claim, it would be good to have a confirmation that no, the three criteria, 20% of households, 30% of children, and so many people dying per 10,000. It would be great to have a confirmation that all three, including the 30% of children with malnutrition, could be confirmed. Thank you.
Thank you. Jean-Martin?
Thank you, Christian. I'd like to help with that. There are different ways of measuring malnutrition. One of them is weight for height. And that's when, if measured by weight for height, so that's you measure how tall the child is and you weigh the child. When you get 30% above the malnutrition as assessed by weight for height, that's where you're in famine territory. Now, the IPC manual also provides for using MUAC, which is mid-upper arm circumference. You measure the upper arm of the child with a tape. Both are acceptable measures, but they're very different measures. And the equivalent to 30% in weight for height is 15% by MUAC. That's been established, again, by the nutrition community, by the experts who are part of the IPC and even outside the IPC. What happened in Gaza City is that the threshold of 15% MUAC, mid-upper arm circumference, has been exceeded. The incidence of acute malnutrition by the MUAC in Gaza City has tripled between May and July. The use of the MUAC as a measure for the IPC has been accepted for years now and has been used in past famine confirmations as well. So I hope that reassures you. All that information, it's very technical, is available online if you want to double check as well. We're also happy to take further questions if we want to get into the details of that.
Yeah, thank you very much. And yeah, as one of our colleagues here is saying, I mean, that would be a simple solution to verify all this Christian, that would be to let international media in to verify and to see by themselves. But I think Jean-Martin has been giving you the scientific answer, and I thank him very much for this. Rick, I see your hand moving. Is that
No,
you want to
sorry.
add something?
No, nothing
Okay.
to add.
No worries. Thank you. It's hard to see from here. Gabriela, very last question. Also on Gaza, I understand.
Yes, thank you so much, Alessandra. My question is, was oxycodone drug found in flour bags distributed by Israel in 8 centers? And if it's true, because I was on vacation, I don't know if you already talk about this, but I understand that oxycodone drug, it's a serious thing. I don't know what are the main effects of this drug, if you have any evidence on that. Thank you so much.
Rick.
Yeah, I heard, I think we heard the rumors, I wouldn't know at all. There's no confirmation of that at all. So that's all what I can say. We don't know.
Thank you. That is very clear. So I'd like to thank all the colleagues who have been speaking this morning on this. Let me remind you a couple of things. First of all, that you have the information on the complete information on the IPC website. We also have several agencies that have spoken this morning and others, so FAO, UNICEF, of course, World Food Programme and WHO, who have published a joint press release that you find on any of their websites, where they say, in addition, of course, as we said, to confirm the famine for the first time in Gaza, they reiterate the call for immediate ceasefire and unhindered humanitarian access to curb deaths from hunger and malnutrition. So you have this also on these websites. You have also the statement from the Secretary General in your mailbox and by the Commissioner General Lazzarini on his social media. And I see in the chat and in my message on WhatsApp that you're all asking for the notes of Tom Fletcher from this morning. Jens tells me it's coming, but you can already see the video on the UNOG multimedia room. And it may be that in the meantime, yeah, I think it's arrived. Ocha just sent it out. So you have now also the remarks on Gaza that Tom Fletcher gave this morning at the press briefing. And I'd like to thank really everyone. Rick, please, stay safe in Gaza. And we really are happy that you connected this morning. Good luck with your very important work. Thank you very much to Jean-Martin Bauer to connect from Rome. That was really insightful. And thanks to Jeremy for the human rights approach. I have just one last information for you that comes from the Committee on the Rights of Persons with Disabilities, which is concluding this morning the review of the report of Finland. And next week, they will complete their meeting by issuing the observation on the 4 countries that they have reviewed, which are, in addition to Finland, also the PRK, Kiribati, and the Maldives. So if there are no other questions, I'd like to thank you very much for having followed this long but extremely important briefing. Thanks again to all our speakers, and I wish you a very good weekend. Thank you.